Okay, good afternoon, everyone. Louise is not going to be here today, but I have the team here, and I will be running the meeting, but I have the team here to back me up in case I need help. But anyway, thank you all for coming, and I hope you're all doing well. I'll look into, okay, sorry. Okay, Louise sent me her updates, and then I'll ask the different admin folks to give an update or help me with presenting all the list that she has on this. The first one she said was the modified quarantine that we have only applies for the entry into the fall semester. So that therefore means that if students would go on vacation during spring break or during the holiday break, then they come back, the modified quarantine is no longer going to be in place. So it stopped at the beginning of the fall semester. Is Noya around yet? Okay. Noya.
Sorry, Maria, can you repeat it again? My computer is lagging right now.
The modified quarantine, it ended already because it only applies for the beginning of the fall semester. And so if a student, let us say, goes on vacation during the spring break or during the Christmas break, when they come back, then they will have to be quarantined if we still have it.
So this is something that, I think we assumed it would have been over, but the problem is right now, even if UH makes the decision to get rid of it, because HPU and what's the other school, Chaminade, is still looking at doing it. They haven't confirmed whether or not they'll get rid of it. So as of right now, I won't say that it'll be closed. It might be open for those students later on, but that was our last meeting on Monday, and we said we'd bring it up again because I believe for some of the students, I maybe had one additional student who's just finishing up the modified quarantine because they arrived late into the state. But I don't know. I think we are leading toward it, but that's really out of the Vice Chancellor for Student Affairs, and it's probably going to be made up at the officers level with President Lasner.
Okay, so as of now, we don't really know where it stands.
Yes, as of right now, it's still open. Like a student could still apply for it because I think UH Manoa has some students still in participating in the modified quarantine. But we asked to close it, and that's a decision that's out of our hands.
Okay. Okay, so thanks. Now the other thing that Louise has on the list is that she just wanted to let us know that JAPSON for COVID testing lab is moving forward. Back in May, I think there was an announcement that the city and county would partner with JAPSON for COVID testing. And it seems like it's happening now or it's happening pretty soon that JAPSON is going to be involved in the testing for the state. And then the other update that she has on her list is that any suggestions from the campuses for the budget, and this is in regards to Erica's presentation yesterday. It should be submitted either to Louise or to Erica, and she's gonna put everything together, compile the big ideas, input, and suggestions from all the other campuses. So I think Mike and Erica have met with all the other campuses already. I mean, as far as I know. So if you have any ideas that you would like to submit, please send that to Louise or to Erica. That's what she said. She's gonna accept them. Like we can email her if we want to go directly to her too. But she's gonna put them all together. and then present it back to the system, to all the other campuses. Now the other, okay, one of the other updates that she has is something that Carol can talk about. Carol, it's the city and county for workforce development training.
Okay.
That you got.
All right. The University of Hawaii Community Colleges worked with the continuing education people across the system, and we submitted a proposal to the City and County of Honolulu for CARES funding. And it looks like, you know, all the paperwork is going through, and so the system is going to front some money for us to get started, because the programs have to get up and running very quickly. And as you know, it takes time to get, you know, paperwork through the system. So training has to begin in October for the various programs that were submitted and have to end by the end of December. We have to have services, student support services, and then also we need to work with job placement, you know, career services as well. And I think every campus has some program that we're going to be running. There's going to be a press release that goes out on the 27th of September, and social media announcing the program. And I think the name of it is Oahu Back to Work. And you know, we are in the process, we're trying to get a meeting together with Lori Burke, John Richards, because it will involve some IT faculty, and there are quite a bit of non-credit health programs that are going to be run off of this campus, as well as all of the other community college campuses. So we're going to be training about 2,000 unemployed people, and so wish us luck. It's going to be a big project, and we do have to, it's all going to run through Destiny registration system.
Guys have any questions on that one? Any questions for Carol? No? Okay. And then the next one, I think Brian can talk about this. There are discussions between UH and the Department of Health on the boundaries between the two agencies for the responsibility for contract training. I know Brian has been involved with this for quite some time now. And he's our contact person for, I mean, he's the one that we report to for any incident here on campus. And he's been the one working with the Department of Health, or contacting the Department of Health and facilitating or coordinating contact training here on campus. But Brian, can you talk more about, you know, where your responsibilities end and when do they start picking it up?
Sure. We don't have anything formal in writing. I'll say this, everything that you guys have been reading about the contact tracing program at the Department of Health up until about 3 weeks ago was exactly that. It was all true. It was in bad shape. It has gotten, however, over the last couple of weeks, maybe not 100%, but it's gotten leaps and bounds better. They are responsive. And so essentially what happens on our campus when there is a situation, whether it's a student or whether it's an employee who reports that they were on campus and are not feeling well, or they are on campus and a couple of days later they tested positive, we'll go back 48 to 36 hours and identify spaces that they were in. Now, my contact tracing for the student and for the employee is only limited to the campus contact tracing. Not that I don't care about what happens out in the community. It's just that I'm not trained and I don't have the time to go out and figure out who they were in contact with at Walmart or at, you know, the car wash. I care about the campus, and that's where my responsibilities are limited to. I will say this, the fact that folks are not on campus for long stretches of time, meaning you'll have a lot of students who take a class, but they're only here for that one class and they're not here for the rest of their course load, makes it a lot easier. The fact that for example, nurses, the nursing program they've done a bang up job because they keep things in a bubble. The precautions that the science programs have taken with all of their PPE and the training that they provide to the students. This is the kind of training that you get your first month on the job in a real world after you graduate. So it's a benefit to these students that they're getting this type of training on PPE and proper care. But the contact tracing is only limited to the campus. Once I get the basic information, say from the instructor, and I'm looking at Lisa, I'm sorry, you popped up right in front of me. Lisa Kanai has a student. She lets me know what's going on. What I count on Lisa to do is to provide me information on who the student is, number one, what the student's contact information is, and as best as possible, who that student was around. Now, Lisa only knows so much. She's not following the student from the car to the classroom. So I'll then contact the student. And all of the students and anyone who's been affected has all been very cooperative. We have not had one person yet who has been difficult. And so I'm very appreciative of that. Everyone understands the public health impact. Everybody understands the safety of the campus is at stake. So everyone has been very cooperative. And then it's at that point I work with the student and discuss, where he or she was, who he or she was with, and then we'll get information out to the impacted individual. I will then contact Department of Health and make sure that my advice and the advice we're giving to the students is in fact correct. And so far, so good. For what it's worth, I know it was not a great program. It's gotten better, but we haven't necessarily been wrong on one yet. They're taking the position of being as conservative and cautious as possible. So yeah, and then I'll just work with the Department of Health. Now, when the time comes for someone to return, we do ask that the individuals provide us with a letter from the Department of Health clearing them to return. And because of their caseload, the Department of Health has recently changed their policy, and they are no longer providing that note to clear folks. So we're asking individuals to work with their physicians and get clearance that way. So that's kind of the contact tracing in a nutshell. It's a lot of time on the phone. My cell phone minutes went up like 33% in I think it was August was kind of when things started heating up for us. So yeah, there's a couple of questions here. If an employee tests positive, this is from Sally, if an employee tests positive who never works on campus, do you still need to know? We need to know. That's a great question. We need to know not to be prying. We need to know not because we need to know everything. We need to know because as long as that individual works here or goes to school here, he or she is entitled to come here. And we need to make sure that the communication goes out to them that says, hey, you please make sure you stay away from campus for at least 14 days. And we're strongly recommending that you quarantine for 14 days according to CDC and Department of Health guidelines. Now, we can't make folks quarantine, but if we don't tell the individual that they need to stay off of campus, then no one outside of the guidelines that are written will tell them. So that's why we need to know, and we'd like to know. Denise Pearson asks, if you get a covered test at urgent care, will they send you a letter with the results? COVID. If you get a COVID test at urgent care, will they send you a letter with the results? Yes, they will. Meaning you. When you say you a letter, they will send the patient a letter. And it'll tell you whether you tested negative or positive. Any other questions?
Brian, this is Annie.
Hi, Annie.
I just have a question. If a student is taking all their classes online, but they happen to be visiting the library, are we just hoping they'll notify the campus, or would it be, even that they were on campus, or would they be notifying the Department of Health, who would then notify you?
So if a student is taking their online classes, similar to, I think this is similar to Sally's question, where this is like an employee who never works on campus. In this case, this is the student.
No, I mean, if they are physically coming to the library, but their classes are online, so we don't necessarily know that they're in the library unless we check the record of who's coming in and out. So they would have to notify someone that they've been in the library because they're, yeah. So if they test positive, I'm hoping they would notify the campus or their instructor, or I don't know, or would it be the Department of Health that would notify the campus?
Well, so, you know, going back to what I was talking about with the Department of Health's contact tracing program, there have not been any cases in which I was behind the Department of Health. So I was always ahead of them in all of our cases. Now, when I say all of our cases, we've had six. Six is six more than we ever needed. But in all of these situations, I've been ahead of the Department of Health. So I don't know that they would, you know, inform us. We are counting on a couple of different things. In this case, the student is taking classes online. So we're hoping, and the guidelines point out that you should be letting your instructor know. Regardless, it doesn't say if you're an in-person student or an online student. You should be letting your instructor, your counselor, you know, someone you're close with, I don't know, a mentor, know. At that point, that information should come to Noyal because he's in charge of the students, and then Noyal will let me know that, you know, we have a first party contact case. Now, that's the first way, Annie. The second way is that where everyone should have downloaded the Lumi app, the Lumicite app. And so if that student is answering those questions, then he or she will have to check yes. And if they abide by the app, will not come to campus.
And if I could just tack on to what Brian was saying, and hopefully trying to get to what I think Annie is trying to address. And this is important, especially on the instructional side, when they ask if they gotta, if a student is only in online classes, do we need to notify the campus? And the answer is yes. And it's because situations like this where there may be online, but because they are entitled to use the services, such as the library, we want to make sure that they weren't on campus. So even if, like, when I get the names of students, we do check the entire schedule, and we talk to the student to make sure when were they last on campus and do all of that contact tracing to ensure that they didn't visit any of the others. And I think, I mean, in the end, it's the student is reporting it. If we can be 100% sure that there's nobody who's kind of walking around who has tested positive, that is just, I think it's unrealistic. We try to put whatever communication we can. Students are well aware that they need to report it to the campus. Employees are also aware of that, but that's how we're kind of dealing with up to this point. And within the past cases that we have had, a lot of it weren't on campus, and if they were, we could easily isolate the kind of spaces that were available. Sorry, where they visited, not available. Did that kind of answer your question, Annie?
Okay, yeah, thank you.
Okay, any other questions for Brian or Noel?
Sheila had asked a question. Do we
okay.
need to have proof of a negative test before they can return?
Yes. I'm requiring that for a couple of reasons. There are ways that you can clear to come back. There are multiple, like, you didn't take a test, and you did, so which means you don't know whether you're positive or negative, but your last symptoms ended 72 hours before without having to take aspirin or any type of other medication. There's a lot of check boxes that the average person has to make sure. I think I'll be quite frank and say my approach might change, but I am erring on the side of conservative, and, you know, heck, I want to make sure you're good. I want to make sure you're good to come back. And so, you know, I am asking again for either a physician or a Department of Health letter to clear you to come back. But there are other ways in which the CDC and the DOH do say, you know, you're no longer infected. Any other questions? I will say this before I end this part. Funny enough, it came to my attention on Monday, and I had a near heart attack and a conniption because if you look at the Lumi app, in fact, where is my phone? I'm going to read it out to you guys. There's 3 questions, right, on the Lumi app. And the 3 questions, on the third question, there are 3 large questions, but the third question was in the past 14 days, colon. The second bullet is, have you been in close contact, which is less than 6 feet or for longer than 15 minutes, with anyone who has an active diagnosed case of COVID-19? So JB, John Baristecki, comes to an admin meeting, interrupts us, and John is not that kind of guy, but there was concern here. There was a particular situation in which first day in the classroom, a student could not properly answer that because the student's outside job, like a nurse's aide or something, is to work with COVID patients. Now, keep in mind, the student has proper PPE. She's geared up. She is ready for battle in her workplace. But the student could not answer the question, no. So I ran it up the flagpole, and surprisingly, there was some discussion about this previously, but not a lot at Manoa campus. So we were able to resolve that on Monday night. Now, what's going to happen is the Lumicite app will change. There will be the question, either a question added or a question revised, so that healthcare workers, of which folks like, I mean, just on my first screen here, out of 129 people on my first screen, I see Jay-Z, Jeff Zuckernick. He works with potentially COVID positive patients. All of our nurse faculty who work in the field, you know, things like that. So this would allow them to more clearly answer the Lumicite questions for both our students and our faculty. So that's a good sign that the university is being responsive to this situation. If for nursing faculty or other health program faculty, if you have a student in that situation, until that question is changed, again, specifically the third question, second bullet point, your students can answer no. And then that, like I said, the question will either be revised or a different question will be added. I'm not sure what the approach is going to be yet, but there is a resolution to it. So that's a good thing. Thank you.
Can I ask one more question?
Sure.
It's Candy. I'm not really sure if this is who I should be asking it to, but you can all hear. Basically, I've been having service learning in my classes for years and years, and I think a lot of faculty have that option in their courses. And we really haven't discussed this as a campus, but now some of my students are wanting to do in-person service learning. So there are going to be some virtual options for service learning, but have we thought about that and the policy moving forward? I'm not really sure how to answer students because I'm not sure, are we liable for what is going to transpire out in the community, I guess. So just sort of putting it out there, and I'm not sure who best is to answer the question. I, of course, have asked Denise, but I'm just wondering, as a campus, have we thought about that?
Maria, I'll take a shot at that.
Yeah.
So you're right, Candy. You know, we haven't necessarily had these longer conversations. I think, unfortunately, things like service learning were, you know, sometimes backburnered as we worried about just making sure we can get the core education components delivered.
May I interrupt you, Brian? It's not on the back burner. It's alive and well. And by the way, I'm going to be putting something up in the chat box. We're having our first ever virtual community partner fair, which Maria was going to give me time to announce later. But since Candy brought it up, there are opportunities for our students to do service learning virtually and maybe in the future more in person. But I'll be sharing that in the chat box in just a moment.
Okay, and so in terms of your question with regard to, you know, liability waiver and things like that, there is one right now that was just blessed by legal for our labs. And I know for the science folks and anyone else who has labs, I'm not even sure at this point if it's been pushed out to you folks. LP literally just got the clearance and the blessed document, I believe yesterday. I think something like that, Candy, that type of document, which, you know, requires the student to, you know, sign off, you know, and not hold the university, you know, harmless in situations like this. Basically a liability waiver can be used for the service learning aspects. So
I'm asking, Brian, I'm asking Amy right now because Amy was the one who spearheaded this waiver form with OGC and Louise. So Amy, maybe you could say something about this one.
I'll take a look at the waivers. We did ask for updated waivers to include addressing COVID as well as a few other updates. But then we also have a separate field trip waiver that they didn't change because it didn't really need to be changed much. So let me take a look at the waivers, and I can work with Denise and Candy and other service learning faculty and see which waiver fits the best for the service learning on site.
Thank you, Amy. So,
yes,
you know,
hopefully that answers your question, Kenny. I think we can get something though put together pretty quickly.
good, because the deadline's coming up for service learning. I believe it's, well, we'll let Denise say because I can't remember everything, but it's coming soon, and I just want to make sure that we're doing the right thing. So thank you.
Yes, this is Denise. Candy, thank you. This is our first pilot project doing this, so it's a test, and it's going to be next week on the 22nd and 23rd via Zoom. I'll put the link in the chat. And on the first day, we're going to be featuring some of our community partners such as Common Cause Hawaii, Hawaii Meals on Wheels, Atherton YMCA, the Access Program, and others. So I'll have a list of who's coming on what day and what time you can Zoom in. People can just link in at any time they like, and I'll put that in the chat. Oh, and it's between 3 and 5 p.m. I'm sorry. So Tuesday and Wednesday, September 22nd and 23rd, between 3 and 5 p.m. We determined that was the best time for students to be available. Thank you.
Okay, Denise, could you put the link in the chat so that everybody can just copy? Okay, any other questions? Okay, the other update that we got and Luis wanted to share with you is the submission of, okay, all the review process for tenure, for contract renewal and tenure and promotion is going to be online. The tenure and promotion, we already had, we had this thing going for a while now. It was a pilot project, but now everybody's going to be submitting a tenure and promotion application is going to go through that online process. I mean, you know, there is already a set technical support for that one. And so those who plan to submit a hard copy will have to submit their application online, and they are going to have, there is going to be training for the submission for the tenure and promotion documents into that particular review mechanism. The contract renewal one is something that just came out and it's very new. We thought, well, I thought it was going to be a campus decision on what to do. Apparently, everything did not work. I even asked Jamie to help me figure out what is the safest and securest way to do it. But then when we brought it up at the VCAA meeting, they said that Google Doc is not safe. It's not secure. Laulima is also not secure because anybody can just download the document, print it out, and things like that. So they're now working on something similar to that of the tenure and promotion, but maybe not as complicated as the tenure and promotion one, wherein the faculty is going to be responsible for uploading their contract renewal document and their appendices. So I know that the deadline for this happened yesterday afternoon. So your chairs should have all your hard copy at this time. But, and then the place where it's gonna be uploaded, they said it's gonna be working on October the 5th. They're working on it right now. So by October the 5th, we can start uploading. So I'm gonna have all the ones who are applying for contract renewal upload their document electronically. And then, so because that is already an electronic version, you printed it out, I hope from a computer. And the appendices, I know is gonna be a little bit difficult because these are your certificates, letters of recommendations or whatever, letters of commendation and things like that. So you can, whoever is applying for contract renewal can ask for that folder from their department chairs and scan a copy of those documents. We've identified at least 3 places on campus that can be used to scan the documents. Ilima 201, the Kalia workroom, and the library. So the only question now is how are these appendices going to be uploaded? It's like I know that there are tabs that you use when you submit this. So can we submit this, or should it be submitted as one big document, or can we submit this with the tabs? So I'll have to find out what mechanism it's going to be, how they're programming it, so that we can find out or give more help and support for the faculty who are going to be scanning these documents. So for submission by October the 5th. Any questions on that?
Maria, can you clarify if someone initially indicated they were going to submit online, there's essentially no change for them, correct?
For the tenure and promotion?
Mm-hmm.
Yes. So all of those who already indicated way in, I guess, August, that they were going to submit, or maybe even earlier than that, there was a training sometime in August already on how to submit the document online for tenure and promotion. For those who were planning to submit a hard copy, there's going to be another training that's going to be done soon for them.
So those that indicated online don't have to now add a hard copy to the process. They just do online.
Yes.
But they have to do both if they didn't indicate it on that form.
Yes. Okay. Any other questions? Guy, I cannot. Why is this so hard to read? Okay, there you go. Because anyone can download. No, the issue, Guy, is more on health and safety of the DPC, the DC, the deans, and everybody else who's going to be touching those documents. Now, The Lolima site, they said, was not secure because you can print the documents from a Lolima site. That was what I was going for, but then they said no to that. And so they checked with ITS if that is really true, and ITS said yes, in Lolima you can actually download and print out the documents, and they do not want these things to happen. So it's more on the integrity of the document, security, and also the safety of those who are going to be reading the documents.
So this is Loge, and if I'm understanding correctly, I'm now required to scan all my documents and submit them online as well as hard copy, and all this is still due on October 2nd. So there's no extension.
You're going for TNP, tenure and promotion?
Yes, ma'am.
Yeah, okay. So yes, you're still submitting the hard copy. And then there's going to be a training for you to submit the electronic version of your documents.
So when is the training going to be?
It's that's why I gave the names of everybody who's applying to Louise, and she's going to be sending that to the UHCC HR office, because they're the ones conducting the training.
So in the initial email, it said, though, that there's no extension of the deadline, which I believe is October 2nd.
Yes.
For the online, and we don't even know when the training's going to be. And then we still have to do all the work to get it online as well. So how are we expected to do that?
The training, I think, is really going to be very soon. I don't know. They'll have to decide on that one, because that's more of the system, system office that decided that everything is going to be online for tenure and promotion now. Because I think at the beginning it was more a choice, right? You can choose whether you want to do online or hard copy, but then because of the situation now, they decided to have it all online.
But we're going to need some time between the training, and is my question, between the training, whenever they decide to do that, and having the ability to get these documents online. And we're looking at, what, 2 weeks right now? So
yeah.
So that's a pretty big ask. I mean, if I did this to a student, I would probably get in trouble.
I think what is going to be, I'm not very sure of this, but I will ask later. I have a VCAA meeting right after this. I think that October 2 deadline is going to be a hard copy, but it has to be submitted at the Chancellor's office by October the 2nd, right? That's the hard copy one. And
Maria?
maybe they'll give you time to upload it. Yes, who's that?
Hi, it's Dave Stevens.
Oh, hi.
I'm not on video because I'm not that pretty. I was going to do the tenure and promotion online, and I did go through the training already. It was on August 11th. There were several dates that they emailed to the people who identified as people who wanted to do the online promotion process. No one ever mentioned to me through the entire process that you also had to do a hard copy.
No, for the online ones who submitted, who indicated way before that it's going to be online, you don't have to do anything else.
Copy that, okay.
Yes, the ones who
the training did happen though, and I think they have it on video. Okay. So I don't think you have to wait for that training. You can actually watch the video, and the people that are assigned as support for the online tenure promotion docs, they get right back to you within like a half an hour if you have a question. It's a really good support system.
Was it difficult? I mean, is it a
No, I didn't find it difficult
process?
at all. If you can do Google Docs at all, it's not a difficult process at all. It's actually fairly fluid and easy to understand.
Okay. I'll find out more about it because this just came out like a day or two ago.
So Maria, is your advice then that they should start scanning their documents now, so that then when they have the training, they'll be ready to just upload? Is that what you were recommending?
I don't know exactly. That's why I was asking Dave. Is it just a Word document that you upload? Is it a PDF that you upload?
Oh no,
I've never seen.
You
I've never
actually,
seen
it's actually in Google Docs, and
a Google Doc. Okay.
everything you do in Google will become a Google Doc. You can upload your Word document and convert it to Google Doc, but it's actually easier just to do it in Google Docs because some people actually have that Grammarly plugin, which is great. You can do it right in there, and then when you upload your scans, they go right into Google Docs as an image or PDF, and it's actually really simple. So advice is start scanning your stuff right now into an image or PDF format. PDF works really well.
Hey,
Okay,
Maria?
I've never reviewed one, so I do not know how it looks like. Sorry.
Yeah, Maria,
Yes.
since this is a last minute change, and since we have several people in our department who are absolutely swamped right now, the last minute change being that it has to be online, I think it would be very kind if we were given an extension, because we do have a lot going on in our department right now, both in training and preparation. And to ask the people in my department to drop everything to start doing the multiple scans may be time prohibitive. And so therefore, I think it'll be reasonable to provide an extra week.
I can ask about that one, Jeff.
Yeah, it's just because the rules are changing all the time. The rules are changing, and it's not fair to the faculty member who has to constantly change according to the dynamics of what's going on. So thank you.
Yeah. Okay. Jeff, how many faculty in your department are going for contract renewal and tenure and promotion?
3.
For contract renewal?
2 contract renewal, 1 promotion.
1 promotion. Okay, I did not get that number. Okay, thank you. And I'll ask about what the concerns are.
Yeah, and just for everybody's understand our predicament, our classes are usually Monday through Thursday from 7:30 in the morning till 3 o'clock in the afternoon. That's just one class. We have one program we teach a semester that's 21 TEs. So it's not, the faculty members spend a heck of a lot of time in the evenings and on weekends prepping for the classes that are currently going on right now. And to add this extra new requirement is time challenging for our faculty. Thank you.
Got it.
So yeah, and I think that's something, sorry Maria, I'll just add something. I think that's something we can bring up meeting, because I think if we compare the process with the contract renewals who just turned theirs in yesterday, basically you turn in the physical document, and then because the timeline is still unsure, they'll have to upload the document, but still meet yesterday's deadline. So I think what everybody's bringing up is really a fair ask to just basically turn it in for the deadline, and then the electronic version should be at a later date. Because really the electronic version is only because of our COVID situation and for review. Yeah. It's not trying to add an additional process. So we can bring that up to kind of have that addressed and then give a specific answer.
Yeah, same as the one for the contract renewal. I mean, it was due yesterday, so everything is already in. It's just the uploading. Sorry, I cannot keep up with all these questions. Guy, you said why not have somebody scan? We brought that up. That was our
maybe just to
our plan from the very beginning, and I can attest to that. We had everything all set, and we know who is gonna scan and everything else.
I'm sure you guys have given this a lot more thought than I have. I do appreciate that, Maria. But I will add this. It's just not fair to give a lot of extra work to the faculty submitting at this time. I get that, and I hope that the administration does too. And I'd like to volunteer if any faculty out there are submitting and you can meet the deadline, and then you're in that sort of gray area where you've already submitted and you just need to start working and move things into the, Google format. I'd be willing to be a mentor or, helping hand to someone, and maybe other faculty can also volunteer. But really that volunteer spirit should also come from admin. You guys should be realizing that the faculty are there for the students, and they're here to do their jobs and teach, and putting something this late onto it. Yeah, of course, it's a pandemic. I get it, but it just, let's all pitch in.
Yeah.
Thank you.
Maria,
And that was the
Maria,
message. Yes.
let me try to add real fast because I get Guy's point, but I think we've tried to chip in, and actually we didn't want anybody to do the work. But I think historically, because faculty have complained, it's been hard for us to do anything because the union has come after us because we've tried to help. So, I mean, I'm all good with it, and having a faculty, you know, say like, nope, Naval, here, you can go ahead and do it. And I think that was our, what we wanted to do from the beginning. But they said, well, you know, historically, this is what's happened, so you can't do it. So I think as much as frustrated it seems like you are, I mean, we're totally frustrated that we're kind of not even allowed to help, which is kind of totally against my culture to just sit around and see faculty suffer. So I get it, but yeah, sorry, I might be sounding a little overly frustrated, but I see what you're saying, but it seems like our arms are just tied behind our back and we can't do anything.
Yeah, Guy, this is Carol. I just wanted to reiterate or emphasize or reinforce what Nava said, because it was true. I mean, some on the admin team did volunteer, but then we ended up having to, you know, back off of that idea because of what Nava said. You know, we were told that, you know, we really were discouraged from touching the document because what if something got left out, or, you know, it was out of order or whatever, and then, you know, we would be held responsible for that, and it was discouraged.
Well, thanks for
Can I
explaining.
interject really quick?
Frustration that you know, Nava explained. It's a union sanctioned process. So when you do help, it's true that you can't help in that way, but why don't you put a call out and see if there's other people like me? I'm really happy to be partnered with 1 or 2 people or more. I'm comfortable in Google Docs. I don't know what it involves. And then if, you know, if I help someone and the decision is against them, then that's between them and me, and it doesn't, you know, we're in the same union, right?
Hey, Maria, this is Dave again.
Yes.
Oh, sorry to interrupt again. I think really, I understand all the restrictions that the union could impose on admin helping with this process. However, I really feel that as far as you can push that deadline out, that would be the biggest help from admin possible. Because people like Guy and me, we can go around and help our peers that we know are also submitting and help them to get through the Google Docs process. But seriously, not everyone's going to have access to a good scanner. And it does take a lot of time to scan individual documents, sometimes when it's photos or passes or something like that. I think time is the key issue. And I don't know how far you can push that out and still be within the realm of possibilities of getting it through the entire process and getting it up to the Board of Regents or whatever. But that time, and not just a week, you might want to consider a month. I mean, this is a big ask, like they said, and this just came down this week. And we're in the middle of a pandemic, and we changed all of our online or face-to-face classes to online again. And we still haven't figured out spring. So everyone's kind of chasing their tails, and this is just adding to the mayhem. I think that's how you guys can help.
Noted. I know that the contract renewal deadlines are campus decided. We decide on the deadlines for that. I am not sure about tenure and promotion. Who's setting the deadlines for all the tenure and promotion, you know, movement of documents? I'll have to find that out. If it's also a campus decision, then maybe our campus can work on it. You know, if it's a system decision or something that was worked on with UPA or decided on with UPA, then maybe, you know, we can have that conversation going. But I'll bring it up.
I'd also like to tell everybody out there that's going for TNP and contract renewal, I chickened out and took the option to push it off a year because of all this craziness. And I was really stressing out. I was having a bad time with it. So I took that option. I recommend it if it's too stressful and the deadlines can't be moved, push it off a year.
Okay, so you have Dave and Guy volunteering to help, and I'll put a call. I mean, I'll put a call for help, and I hope people will volunteer to help help your colleagues. If you're experts in all of these ways of doing things electronically, please do help.
Hey, Maria. Sorry
Yes.
to interrupt. I didn't want you to miss this comment. I think Annie Thomas had a really good point that if there is that the deadline is held for the submission of print dossiers, then you won't actually have your documents to scan. So
No,
that might require like extra copies or.
I think the scanning has to do with the appendices.
Right. But just to make sure that people don't give away their only copies.
Yes, but I think the document itself, your narrative, your all of those things, those I would think you'd have an electronic copy. If not, then print out one.
Right.
Because I do not know what the deadline. If I can move the deadlines, I will. But I do not know if I can say anything more about that one until I ask. I'm not familiar with how the deadlines were set for the tenure and promotion. But yes, if you think you need your hard copy, make another copy. I mean, that's the only thing I can say. Anyway, forget it. It did not work. We went through all different scenarios, and Jamie can say, yes, I asked for her help on this one too.
So how soon will you be able to let us know after your meeting today?
Okay, if I find out anything today, I'll send you an email. I'll send the AAC an email. I do not know how to, I can send the email and CC Noia on it so that he could share it with the student services group.
I mean, I'm just wondering, maybe just even reaching out to Erica on this one, because it's so big, right? It's such a big deal. That maybe if she just knew how it was impacting faculty, she might have a heart.
I know that anything we bring up at the VCAA, Tammy will bring up with Erica at the chancellor's meeting the next day. So hopefully, I bring it up today. They'll have a meeting tomorrow. They meet every day, and hopefully they can discuss it by tomorrow. I'll find out. Okay. But I can't keep up with all these questions. I'm not good at this.
Maria, we know you're the messenger.
I know, such a bad time to be interim. Okay. We have a good scanner, Ilima 206, another Kalia 201. Okay, so library also has a scanner. So there are scanners on campus that you can use, and yeah, and yes, I'm gonna ask for volunteers to help folks, faculty, and I do not know among all of those applying for tenure and promotion, how many have earlier decided to do a hard copy one. Those are the ones that are going to be impacted by this. The ones who have decided early on that they're going to do online, they should be okay. Right? Because nothing has changed. Okay, Brandon's also saying shared services has a scanner. Okay, great. Then we have all of these resources here on campus. Okay, any other questions? Any other concerns?
Maria, this is Kavehi.
Yes.
Can you ask and clarify for the hard copy, those who are intending on doing hard copy, there's, I think here's the bigger issue, not just the scanning. So the e-dossier identifiers that are already working, they don't just scan and then plop it into a Google Drive. They scan their document and they hyperlink all of their evidence in their narrative. So that's an extra step. So can you just clarify that the hard copy submitters will not be, that will not be the requirement for them? Because that's a whole new step.
Oh, hyperlinking your evidence into your documents.
Yeah,
Okay.
yeah.
Was that was that part of the training, Kavi?
It was.
Was that the training?
And
was okay.
Yes, that was for the for the original electronic submitters,
Okay.
and that's really the hard part.
Yeah, definitely. Yes.
Yes. So if the hard copy submitters are going to be held to that standard, then I think you need to advocate for an extension for them.
Yeah. Okay. I will.
Thanks.
Thank you. That's good to know because I've never read any of this e-submission. Okay. Thank you. How can I get the training? Guy, you want to apply again? I know you did it in La Lima.
Yeah. No, I just thought if I'm volunteering to help, I would probably need the training so I could know what I'm getting into.
Okay. Maybe I'll ask Luis if I can put your name down because you're going to help.
Thank you.
Yeah, okay. Thank you.
Thank you, Nava. I'm also up for 5-year review, so this will be helpful.
Okay, any other questions? None. Going. If not,
I don't have a question,
yes.
but I do have something to share. Pahukaina Food Pantry is up again. We'll be starting again this Friday. Our hours have changed. It's now from 12 in the afternoon to 3 p.m. I sent you guys some information. There is a link that you do need to sign up if you want to receive any of our non-perishable foods. And if you have students that are in need, please give them our information so that they can be put on our list as well. And I appreciate everybody. I know it's hard, but we got it, team. Keep talking to each other. Thank you.
Okay, anything else that we'd like to discuss? I will have to run to my VCAA meeting to get this all in. So
Go Maria, go Maria.
So if there is none, thank you all so much. And as Luis always says, and I can always say that too, take care of yourselves, always be safe. And you can unmute yourself and say goodbye to everybody.
Thank you, Maria.
Bye.
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 Awesome job, Maria. Good job.
Thanks, Maria.
Don't blame you, Maria. We know.
We love you, Maria. Thank
We
you.
do. Love you, Maria.